Hello, welcome to Focus to look at antihypertensives. So what are antihypertensives? Like these antihypertensives, we are going to look at different classes of antihypertensives, types of action, some examples under these classes, and their possible side effects. So before we do that, we need to know what brought about antihypertensives. Why antihypertensives? So this is something that we need to know before we dip into antihypertensives, before we look to it all. So first of all, we need to know that antihypertensives are medications, drugs, or agents that are being used in managing hypertension. That is blood pressure lowering medications. Very, very important. So what brought about antihypertensive? Why antihypertensive? Because there is hypertension. Hypertension, as we all know, hypertension is not something new to us. Simply means high blood pressure. That is when the force being exerted on the walls of arteries is above normal range in which it is supposed to be, meaning your blood pressure range is above the level it is supposed to be, and in which benefit or maximum benefit can be obtained from lowering this blood pressure. Blood pressure, meaning, or rather say hypertension in other words, or high BP, as you wish to call it, have no specific signs and symptoms. That is why it is termed as the silent killer. You can only get to know if you're hypertensive or not. The only way to know is to get your blood pressure being checked by healthcare professional or your healthcare provider. And this can be done by using an instrument known as sphygmomanometer. Sphygmomanometer, which is well effective and getting correct and accurate reading from that sphygmomanometer by your healthcare provider. What will give you the assurance that your blood pressure level is elevated or not. So meaning, are you hypertensive or hypotensive or normotensive? From where did you fall in between these three? So as I said earlier, it has no specific signs and symptoms, but in severe cases, there can be severe headache, dizziness, among all. Hypertension comes in two different ways, or I would rather say types. Yes, because there's essential hypertension and there's secondary hypertension. Essential hypertension, as in how, and essential hypertension accounts for about 90 to 95% of patients with hypertension. When hypertension have no underlying cause, there's no underlying cause for hypertension, is being termed as essential hypertension. Like I said, this type accounts for about 90 to 95% of patients with hypertension. I have the secondary hypertension. This secondary hypertension accounts for only about 5 to 10% of patients with hypertension. And secondary hypertensions at times can be due to different disease conditions and even some drugs. Yes, some drugs even. Some disease conditions such as coronary heart disease, such as diabetes mellitus, such as renal disease, because these diseases, if you have been exposed to them, these diseases places you at the risk of getting hypertensive, or these diseases prone, or rather say stimulates your blood pressure level to rise above higher range in which it is supposed to be. So, and hypertension, something more on it, there are many factors that can contribute to it. Many factors, risk factors. There are risk factors that can expose you or make you prone to hypertension, such as obesity, such as lack of exercise, such as age. As you age older, you become prone to hypertension, such as race, more especially older and black people. So there are also things, the pathophysiology of hypertension. There are some factors involved, such as renin, angiotensin, aldosterone system, such as cardiac output. But for me, I would like to corner my attention or focus on this renin, angiotensin, aldosterone system. How does it come about? How does it make you hypertensive? This renin, angiotensin, aldosterone system. Renin is a hormone that is responsible for secreting a renin its substrate, which is being known as angiotensinogen. And angiotensinogen is that substance that is being involved in the maintenance of your blood pressure. So angiotensinogen is, no, sorry, I rather say angiotensinogen is being converted into angiotensin 1. It's been involved in the process of conversion of this angiotensin 1. How? It plays a role, a very important role, particular role in the conversion of angiotensin 1 into angiotensin 2. Angiotensin 1 normally is not a problem, but the real problem there, the main problem there is the angiotensin 2, because angiotensin 2 is a vasoconstrictor, meaning it makes your blood vessels in the heart become constricted, and also it causes the retention of sodium in your body, of which sodium, as you know, also cause a rise in your blood pressure. So having now known this, now you know if you're hypertensive, definitely you need to get your blood pressure lowered. How to get that is to get antihypertensive medication. So like I said earlier, you like to look into this antihypertensive. So these factors brought about antihypertensive. Let's quickly look into it. There are different classes of antihypertensive medication that are being used in the management of this hypertension, that are being used in lowering of blood pressure. First, we have the drugs of this angiotensin, renin-angiotensin aldosterone system, of which there are two classes under it, meaning the angiotensin converting enzyme inhibitors and the angiotensin receptor blockers. Let's start with angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors, these are drugs or agents that works their mechanism of action. They are involved in the inhibiting the action of angiotensin converting enzyme. How? Thereby preventing the conversion of angiotensin 1 into angiotensin 2, thereby preventing the retention of salt and water, and results in vasodilation instead of vasoconstriction. Examples of these angiotensin converting enzyme inhibitors, we have the enalapril, ramipril, perindopril, and many examples under it. Angiotensin converting enzyme inhibitors have a very prominent side effects of dry cough. Why dry cough? Because it has been found that these ACEIs, angiotensin converting enzyme inhibitors, are found to block kinase production. Kinase production, if they block kinase production, therefore they result in bradykinin. They result in which prevent the breakdown of bradykinin, and also by preventing the breakdown of bradykinin, definitely develop this lead to this dry cough. So the second class of this system is the angiotensin 2 receptor blocker. These agents work, as the name implies, work as the receptor to they block the action of this angiotensin 2 totally. Losartan, valsartan, irbesartan are some examples of drugs under this particular class of this angiotensin receptor blocker. Some possible side effects include edema, headache, renal failure, among others. We also have the alpha adrenal receptors. These are alpha adrenal receptors. These agents block or inhibit the blood vessels. Alpha adrenal receptors, alpha adrenal receptor blockers. These are agents that block or inhibit alpha adrenal receptors in the blood vessel by preventing noradrenaline induced vasoconstriction, and by preventing noradrenaline vasoconstriction thereby results in reducing your high blood pressure. Prazosin, doxazosin are some examples of medications under this class. And we also have the beta blockers. Beta blockers, these agents or these drugs are somehow their mechanism of action is uncertain, but they are somehow being found to reduce the secretion of renin. To reduce the secretion of by reducing the secretion of renin, thereby result in antagonizing the beta adrenal receptors in the juxtaglomerular apparatus of the kidney, in which reduces cardiac output in short term and during exercises. Example: atenolol, labetalol, carvedilol, propranolol, some of the examples under this class. And we also have there's another class which is known as the calcium channel blocker. Calcium channel blocker, these agents block calcium channels in the peripheral blood vessels of the heart. There are examples of these agents cause these
here is somehow found to be involved in the elevation of blood pressure. So this agent works by blocking those channels so that your blood pressure remains normal as it is supposed to be. There are amlodipine, nifedipine, nimodipine, and some more examples under this class. If you can consult your essential medicine dictionary, you can see lots of these examples. We also have the diuretics. Diuretics are of three different types. We have the thiazide-like diuretics, thiazide diuretics, loop diuretics, and also potassium-sparing diuretics. Thiazide diuretics, some examples of thiazide diuretics, we have dendrochlorothiazide, hydrochlorothiazide, and their work specifically is in the distal convoluted tubule of the kidney. So we also have thiazide-like diuretics. Thiazide-like diuretics, we have the clothalidone, indapamide. So have the loop diuretics, of which their work specifically is in the loop of Henle. And these agents, there are furosemide, and many other examples. Have the potassium-sparing diuretics, which works specifically at the proximal convoluted tubule. As thiazide works in the distal convoluted tubule, potassium-sparing diuretics works in the proximal convoluted tubule. Spironolactone, sodium nitroprusside, some of the examples of drugs or medications that these classes. There are also central acting agents such as methyl dopa, specifically used in pregnancy, potential in pregnancy for pregnant women. And also there are hydralazines that are also involved in reducing your blood pressure for in severe cases that we use hydralazine. So in general, hypertension or high blood pressure cannot be reduced only with these medications. There are some also other non-pharmacological interventions that can help you maintain your blood pressure, such as doing exercise regularly, by reducing the too much intake of fats, by reducing the too much intake of salt, and many others. So if you get excited, these are things you can try. Like I said earlier, these are not just the classes of medications used in the management of hypertension. There are many others. But as for this, these are the ones I've been able to get for you guys. So what do you think? If you watch this video, what do you think? What will be your own reaction? Let's meet in the comment section.